Welcome to Sofwave's live webinar, Capturing the GLP-1 Patient and Menopause Market. I'm Carolyn Grimes with Sofwave, and we're so excited to have Dr. Amy Lewis, Dr. Jay Burns, and Debra Sullivan with us. So let's start things off with some quick introductions. Dr. Amy Lewis is a Manhattan-based board-certified dermatologist who trained at Penn and Yale. She completed her internship at Cornell New York Hospital and was chief resident at SUNY. She founded the Yale Cosmetic Dermatology Division and now serves as a clinical associate professor. She'll be walking us through how Sofwave rebuilds collagen and elastin and how she uses Sofwave consistently in her practice. Debra Sullivan is a nationally board-certified and accredited physician assistant. She's been practicing for over 25 years, focusing on peri and postmenopausal patients and a whole patient approach to aging. She'll discuss how we connect hormones with collagen loss, muscle decline, and skin quality issues. And finally, Dr. Jay Burns. He's a board-certified plastic surgeon and world-renowned expert. For over 30 years, Dr. Burns has helped patients transform through a combination of surgical and non-surgical rejuvenation. He treats a high volume of GLP-1 patients and has become an expert at combining Sofwave and PureImpact into his treatment plans. He's the director of Resurrect Skin MD in Dallas. So thank you all for joining us this evening. And Dr. Lewis, you're up first.
All right, so we're going to talk about one of my favorite machines of all time, my favorite technology, which is um, parallel beam technology, which is what we know as Sofwave, for an ultrasound treatment for our face, neck, and other areas off face, which is body, because it's good for body contouring in lots of different ways. But the way it works is by rebuilding the skin's foundation. So, in young skin, ages 15 to 25, we have highly dense thickening and with an organized matrix that looks like a real organized lasagna with your collagen and the elastin in between and good hyaluronic acid. And it gives a high tensile strength. So it has that elasticity and the spring back of youthful skin. So it resists gravity, has the resilience, and then as we get older, unfortunately, it doesn't have that spring back as much anymore. It has low elasticity, yields to gravity. Therefore, we get the jowling and we get the signs of older skin and old age, which we all don't like. So what we want to do is we want to increase collagen production. We want to stop the fibers from breaking down. We want the elastin fibers to improve and be more resilient and more abundant. And we also want more hyaluronic acid because hyaluronic acid binds 1,000 times its weight in water and gives that plumpness. And I don't mean when I say plumpness, I don't mean like the fullness that you see when people are overfilled. The plumpness of the youthful skin, that it looks, you know, not dehydrated and it looks healthy. That's what we're talking about when we talk about the plumpness of youthful skin. And what's really important to remember here is that after the age of 25, our collagen production goes down like a really steep curve and then it starts to level off. So even though a lot of patients or, just people who are in the age of like say 35 and 40, they may not see so much of the loss of the collagen yet, but it's been going on for a while. And that's why even in my practice, we talk to patients who are like between 25 and 35 for prejuvenation because we want them to start getting that collagen building and the elastin building and get their skin in better shape so that they don't have to reverse damage, so that they can prevent the damage in the first place. And they don't have to do as many treatments that way because you're then just revving up the collagen production. Because remember, after 25, the production starts going down and it will, just parallel off for a while, but we want to start boosting that along the way. So the earlier you get this intervention, the more youthful skin you'll have for a more prolonged period of time and less chances that you'll have to reverse as opposed to just prevent. This is the FDA clearances for this technology, and it shows you how it delivers the 7 parallel beams of energy right into the dermal layer, which is 1.5 millimeters into the dermal layer. And it causes collagen abundance and increased collagen just the way it's leveled off in really in nice lamellar bands as opposed to crackling and all over the place. And you see like the break broken down. So you can see on that histology on the right, you see the density of the collagen that's after the treatment. And if you see that, you can actually probably make it a little bigger, but you can see it's approved and used for the neck. We use it around the eyes, use it on the body and arms. It's been FDA approved for the arms, so it has approval for tightening. We're going to go through them all, but also for lifting. The lifting protocol, as opposed to the tightening protocol, is 2 sessions, 6 to 8 weeks apart, as opposed to just 1 session for someone who's probably in the low 40s or younger, who doesn't need that real lift, but needs that tightening and more just improvement of collagen and elastin formation. It has been approved for the first one was facial lines and wrinkles. Then it had a lifting protocol for the brow, for the submental area, and for the neck. So it got the lifting protocol for all 3 areas when it went to the FDA, which is pretty astonishing and amazing. Has the FDA approval for the improvement in cellulite and improvement of acne scars and for the skin laxity in the upper arms. At this time, there are some other protocols undergoing right now that will be submitted to the FDA. One is for like on the abdomen for tightening, which I can tell you we've used in my practice with great results. I've used it above the knees. Again, this is off label, but just to put it out there that it's being done and studied at this point. So the synchronous ultrasound parallel beam, aka superb technology, um, increases the integrity of underlying structures. And by being very selective in what we're targeting in the dermal structure. So we're going into the little dermis. That's where your money is. That's where you want most of your energy to be. And that's why this is so effective because it really does that parallel beam technology and putting all 7 beams into that area so that every time you do a pulse, you're getting a lot of energy right there. You're not wasting it above, below, and on the sides. It's a targeted depth, like we just talked about. And the area that it is targeted in the dermis is very reproducible. And also on the superficial side of that, there's the soft cool technology, which gives it a cooling while you pulse. And you can change that cooling a little bit based on patient's tolerability or desire. I don't think that you really need much more than just the minimum for any patient, but you can always increase the cooling if you need to. So how does it work? So it has this ultrasound that passes through the epidermis, like I was saying, and it goes into the integrated area in the dermal level at 1.5 millimeters. It's water collagen there, and so the heat goes right where it's needed. And they're basically making an analogy to like a modern induction cooktop, which is cool when you put your fingers on the cooktop and it's only heating up the exact rings that you want heated up. So that's basically the rest of your top would have like that soft cool technology so that you can put your hand on the surface on the glass and not burn yourself. And it only heats up the rings, which is where the energy is, where the dermis would be and where you want to promote collagenesis. Basically, it's like a full self-driving dermal remodeling. So you have the steel eye beams, the parallel beams, and then you have the neocollagenesis and the neoelastogenesis and the new hyaluronic acid, which is the biology and the rebirth of the structures that we need. The mechanism that gives you the shrink wrap is that remodeling and the elasticity from the new elastin structures, because that gives you, again, that spring back. And then we have the safety, which is the airbags, which is the soft cool technology, because that is your second check mechanism to make sure there's no damage on the superficial areas to structure, as it would be if you were in a car accident, and it will support you and protect you. And then this is a predictable path to natural looking skin with zero risk of fat loss. And the reason why I'm going to say that again, zero risk of fat loss, is because this is a big thing in the media right now, because there are some microneedling devices, there are some ultrasound devices, there are some other energy-based devices that have been known to cause fat loss. And the reason for that is because the energy is being delivered much, much deeper into the fat area and is not selective for the dermal area. And so you have to be really careful. That is not the case with Sofwave. It is a very safe procedure. It doesn't go deep enough to even affect any of the glandular structures. So it's very easy to reproduce in your office and to teach other people how to do it because you're not going to get into trouble. I have lectured many times on many modalities, and I can't tell you, even in the last couple of months, how many people have asked the question while I'm on podium, will this reduce fat? And is there any chance of it causing fat loss in the face or the neck? And the answer is no.
Hello, my name is Debra Sullivan. I'm a physician assistant, and I am currently in Newtown, Connecticut. And my practice is Newtown Medi Spa. And I'm here to talk tonight about different treatment strategies and case studies revolving around menopause and perimenopause. So hormones, when we're looking at hormones and we're saying the untapped vital sign, menopausal women are the fastest growing demographic in the workforce right now. Right now, there's about 1.2 million women entering menopause annually, and there's 1.2 billion women globally who are menopausal. So it's a huge market of women. And in this market, we have distinct changes in the skin during menopause, secondary to the role of estrogen. Estrogen will modulate both the epidermis and the dermis, and it plays a significant role in wound healing. So perimenopause and menopause, there's been so many studies through Brincat, Affinito, Stevenson, all showing that within the first 5 years of menopause, there's this drastic loss of collagen. We'll have collagen decrease up to 30% in the first 5 years, with about a 2.1% loss every year thereafter. So collagen is decreasing because estrogen stimulates collagen 1 and 3. Estrogen will, the loss of estrogen will decrease, will increase the MMPs, the enzymes that help to degrade the skin, and also improve, estrogen will improve dermal thickness, and the loss of estrogen will do the opposite. Also, we have progesterone loss in our 40s, and in our 40s, that's the perimenopausal area, we'll see that as progesterone falls, we're going to have a decrease in fibroblast activity, and it can affect both collagen and elastic network. This results in thinning skin, wrinkles, increase in number of wrinkles and rhytids, increase in skin dryness has to do with menopausal area, where we're looking at a decrease in testosterone in a woman's 40s. It affects the sebaceous glands and decrease in the receptor availability. So in premenopause and menopause, when we're looking at comparing skin structure and pre and postmenopausally, it's a powerful comparison because the difference isn't just thinner skin. It's structural, it's cellular, hormonal, mechanical. We're looking at, as in the young skin, we have collagen that's well supported with the structures around it, elastin fibers. As you age, start to fragment and break apart, and you're losing the structural support on either side of those fibers. You're going to see just a lot more disorganization in the aged dermis than you will in the young skin. And I think it's important for everyone to understand elastin. So elastin is responsible for like the recoil and the snap. So elastin's mostly made in your fetal life. It's mostly made in early childhood, and it has a very long half-life. Elastin has a half-life of about between 40 and 70 years. So it's difficult for an adult to create new elastin. And most of the time, what we're trying to do when we're trying to support the elastin is support the structures around it. With menopause, we see structural deterioration. We see impaired maintenance of the elastin, and the fibers that are anchoring it start to weaken. So it's more biomechanical than it is quantity loss. In this study with Brincat, they showed that with hormone replacement in a woman, it definitely stops the further loss of collagen. It stops your further loss of elastin when you optimize your hormones. But it was a very discordant study. It wasn't conclusive of whether or not hormone replacement will lead to building up the collagen that you lost and building up the elastin that you lost. So that's where we need energy devices to come into play. And this is where Sofwave. So I've been in practice now for about almost 15 years, and I've had a variety of different energy devices. And by far, Sofwave is the device that produces the most lift, the most tightening because it has such a specific mechanism that targets the dermis exactly in the same place every single time. So Sofwave, with the controlled heat that it delivers that Dr. Lewis was just explaining, it helps to activate the heat, activates these heat shock proteins. And the heat shock proteins are very relevant in skin remodeling. They help to stimulate fibroblasts, they stimulate neocollagenesis, and it's also been shown that Sofwave helps with actually neoelastinogenesis. So it's helping to increase the number of collagen fibers and the number of elastin fibers, while it also takes the existing collagen and elastin fibers and helps to remodel those. So we're seeing a really great improvement in both elasticity, thickness, and firmness of the skin. So with the muscle, there was when we're looking at how the muscle affects the skin, when sarcopenia, we know it affects many things, but sarcopenia as we're aging, there's that cross section to your right there is just the cross section of a quadriceps muscle in a young athlete and then in an older person. And I actually saw a really great study where you see as you age, your muscle degrades and you have the surrounding adipose tissue. But someone who maintains that muscle mass will have the same cross section as they did as when they were younger. It's not something that has to happen through age, that your muscle degrades and is surrounded by fat. With exercise or muscle stimulation, you can maintain that muscle. But when that muscle does start to degrade, and it does start to degrade in menopause, because with menopause, the loss of estrogen will lead to sarcopenia. The study that I'm referring to here, the SWAN study, is a study on women's health across the nation in 1994. And the research investigated physical and biological changes to women in menopause. And they found that at 40 to 55 years old, 20% of women had a physical functioning limitation. And by the age 56, which is my age, to 66, 50% of women had a physical functioning limitation. And this was primarily due to the loss of muscle mass, secondary to the inability to keep it up through menopause. As estrogen decreased, the muscle mass, the lean muscle mass would decrease and the adipose tissue would increase. So this is leading to an increase in all-cause mortality, cardiovascular health risks, and increase in insulin resistance. The reason why sarcopenia is happening here is because as estrogen decreases, the satellite cells in the muscle, the efficiency of them decreases. And remember, muscle is definitely can be considered an endocrine organ because it releases interleukin 6. Interleukin 6 will then lead to chronic inflammation and decrease in collagen synthesis. So crepey skin can be twofold. Crepey skin can happen in the skin. Crepey skin can also happen within the muscle. So crepey skin is due to thinning of the dermis, thinning of the epidermis from the estrogen loss, leading to collagen loss. And with sarcopenia, you're going to get that loss of tension. With that loss of muscle, loss of tension, and loss of that structural support around the skin. And that's going to lead to the skin becoming saggy and more laxity. And this is where you look at PureImpact and sarcopenia. Without training and without muscle maintenance, you can lose a total of between 3 and 8% of your muscle mass per decade after the age of 30. So this all starts happening to women and men in their 30s. So without maintaining that muscle, you're going to have muscle loss that leads to chronic inflammation, again, insulin resistance, oxidative stress, and you're going to increase your all-cause mortality. So this is where a Sofwave and PureImpact, the estrogen decline will lead to lean muscle mass decline and changes in the skin. So they occur together. And this is why if you only address the dermis and you only address the sarcopenia, your results are limited. Combining these two modalities really helps to improve the texture, the quality, and the volume of the skin. And that's why we're seeing such impressive tightening when you combine the two modalities. This is one, so I think it's really important when talking about Sofwave. I only practice in my practice with the treat to total energy technique. With this patient here, we treated her entire face. We used a total of 8,902 joules. I really like to point out, she came back for a second treatment just of the lower jowl area, so the subzygoma and then wrapping a little bit around the mandible. You can see here really nice tightening of the infraorbital ligament. I see that in most of my patients after the Sofwave treatment, where that infraorbital fat that started to herniate out a little bit looks like it was tucked back in and tightened up. You could see that she has some dermal thickening around the forehead, which is very difficult to achieve in aesthetic medicine. And she even gets that little bit of an eye lift, lateral eyebrow lift on either side of her eyes. And if you look at the shape of her face, her lower face, it's such a drastic difference between the before and after. Before, it looks like an oblong shaped face a little bit. And on the right side, after the 2 treatments, she looks like she has that nice sweetheart shaped face. Of course, she's combining this with her hormone optimization, her skincare, diet, sleep, exercise, and we take handfuls of supplements in menopause. This is my second case. This is another patient, also postmenopausal. She had 1 treatment, treat to total energy with 9,000 plus joules of energy. You see a really nice improvement along the jawline and around the eyes. Again, around that infraorbital ligament, you see there's less crepiness in both cases around the eyes, and that little bit of the eye lift there too. And here you can see there's a nice softening of her nasal labial fold. And even I did do some perioral treatment here, and I love to see it. Almost looks like she has a little lip flip from filler or Botox, which she does not. This is solely from Sofwave treatment. It is an all-inclusive approach in my practice. We do hormone optimization, protein, stress, sleep, but without the use of the right energy device, you cannot truly correct both the sarcopenia and the collagen loss of the skin. You're not going to correct that laxity. So the best of any and all energy device that I've ever had in a host of devices at my practice is by far has been Sofwave for the lifting and the tightening. And this is my staff pictures. The first 4 pictures are women who are postmenopausal, all in their 50s. And the last 2 photos are 2 perimenopausal girls in their 40s. And they're making small changes daily and big wins in the health span. And they're gaining a lot of confidence through these treatments. So thank you very much, everyone, for having me. And I hope you learned something tonight.
You know, I've been with Sofwave a while. I headed up the plastic surgery, national move for this. And I think it might be helpful for you to know my history a little bit is that I do a lot of research. I don't like things I don't understand, which means I don't like a lot of things because I'm not that smart. But I will say that I didn't really understand radio frequency. We're trying to tighten skin. And so I went through about 7 devices on that. I was the original SAB for the thermage effort, the radio frequency. And then, we thought if we got needles in, that would solve it, but really only 2 of those do. For those out there that have a radio frequency microneedling device, if it's not profound or genius, it's not really a microneedling device. It's just hot needles. And even if you have those, what I wanted to say about that was I'm not here to promote RF microneedling, but what I am saying is that I have a lot of experience trying to tighten skin. That's what we're trying to do. We're trying to volumize skin more than anything else. And Sofwave, I would echo our speakers before me. Sofwave is by far the best thing that we've used. And if you look at the actual treatment that it affects, it's 20 times more tissue treated than the Genius, which is the #1 radio frequency microneedling device. So I'm also, not only do I have my local clinic here in Dallas, I'm speaking from some perspective that I'm the national medical director of the largest med spa roll-up in the country. And our adoption of Sofwave, I led the charge and I said, hey, you really should do this. And that was in 24 and 25, that was our #1 procedure across our entire group of med spas. It grew us at a rate of around 27% overall. We had other things, but Sofwave has been a huge thing for us. Now, I sound like a salesman, so let me tell you exactly how I got there, because treatment to total energy was developed in my office. James and I spent a lot of that, so I know quite a bit about treatment to total energy. Tonight is not only talking about the device itself, but how it works with GLP-1 drugs and weight loss. I think that there is, I think that there's significant fat loss, there's delayed gastric emptying, there's improved glucose control, a lot of applications, and a lot of people microdose just because it's got so many positive attributes. We have the best stats in the country. We sell all of our data to Allergan and Galderma and the big pharmas, because we have incredible data. We have a whole company that extracts data, and so we know what the market's doing. And so Sofwave has become number two, a close second behind wellness and semaglutides and that whole entire market. So these tie together beautifully. And so the rise of this shot is, I don't think we have, you've talked about it enough. I don't think we have to spend a lot of time on this slide, but there are ways that you can prevent muscle loss, but you have to exercise. You have to optimize your hormones. Johnny Pete's a partner of mine, and he does probably as much hormone replacement therapy as anybody in the world. And he makes the comment that, if I've got somebody optimized on hormones and they're exercising, their weight loss is at a minimum. And so if we add, we're going to talk about PureImpact in a minute, and these volumization with Sofwave, it's just a monstrous combination to have the semaglutides, the HRT programs, the PureImpact and the Sofwave. It's a wonderful way for your patients to get better. The transformational opportunity, as I've been talking about, is treating the skin and the muscle in this time that we live in of rapid weight loss. And so it certainly has rapid adoption. The weight loss is outpacing, it's outpacing what we're doing for the skin. We're trying to catch up and able to treat the skin, and millions of patients are doing it. And again, I've just gone over this, but the Sofwave and PureImpact are a great solution, and it's really a great technology together. Next slide. And so I'm one of the fortunate ones that have both the Lift HD and not only the PureImpact, but the PureImpact, I just know it has 6 devices. I think it's called PureImpact VIP. And so the PureImpact VIP and the Lift HD is exactly like, the regular handpiece, except it's the same. It's a 7 millimeter in length rectangle, but instead of being 1 millimeter with the regular handpiece, it's 2 millimeters. So it's double the width, and we'll show you some histology of how much area you treat. So it's treated in exactly the same way, with exactly the same treatment to total energy. You mark off your square and you treat till you've got the total energy in that zone at whatever zone you want. I agree with the other speakers that the abdomen, stomach, that kind of thing, it's like you have somebody that it's too much, it's not enough. They have enough skin that's not enough for a tummy tuck, but it's you don't want to do a tummy tuck, but it's really not, there's, what can you do for it? And it's perfect for that, and to getting that crepey skin on the stomach. So you can see the areas here. These are just transfer. Remember, these are just transverse cuts through the long axis of the injury. The rectangle's going both in and out of the screen here. And so just realize that cross section's bigger, but it's also that same length of 7 millimeters. And so here's a really nice result that, again, it required a second treatment, but again, over 3-4 months, you're starting to see that tightening. You can really see it there on the elbow. There's and that's where you see most of it, almost all of that. It's exactly the same angle. So those kind of things are really important. As a surgeon, sometimes I'll see my surgeons and they'll go, well, gosh, I could get all of that with surgery. Yeah. And they'll also have a scar going down their entire arm, and people don't want that. And so one of the things that has one of the best decisions I've made, a lot of good decisions, my wife of 48 years, but the other one is that I I'm a plastic surgeon and I want to take all of your patients. I don't want any of you to have any patients. I want to be able to sell, I'm just kidding you, but I want to sell sunscreen. I want to be able to do lasers. I want to be able to do all aesthetics. And so the fact is that I do believe, I see it like most surgeons don't, that this is a great improvement that a lot of people want. They don't want surgery. This is super effective. They can come back and do more. If they get a response here, they're going to get more with a second response. I really love the pearl about, you know, how you stage it at 6 weeks earlier. It's a really good piece of information. And some improvement here. We have we have a few cases like this at our practice, and these patients are super happy. So one of the cool things about the PureImpact, we've gotten that just recently in the last 2 or 3 months, and I had a device that was like this. James Bartholomew is, if you don't know him, I work with companies that have really good engineers, and fortunately, over the last 35 years, I can kind of figure out who a good engineer is. There was nobody to teach me lasers. I didn't learn from doctors. I had to travel 90 miles south of Dallas to Waco to Texas State Technical Institute, and I learned from physicists, and that was the best thing I ever did. It was painful at the time, but James is brilliant, and he was involved with another device that worked on electrical stimulation, and it's a challenge. But you have to design the electrodes. But these are designed in such a way where you can use that. And the advantage is, you know, over muscle stim. I used to speak for muscle stim when that's all there was there. But if you think about it, they're just putting a magnet on your abdomen, and there's no origin and insertion they're grabbing. They're just sucking the muscle in the abdomen up, and it does create some increased muscle, but it's not nearly as effective as if you can put it on the origin and the insertion and you play with it. You learn to do it. We don't have enough time to go into the exact technique tonight. Maybe with questions I could describe it to you, but the technology here is amazing. And you've got 6 electrodes, and you can use 3 muscle groups at a time. Well, this is the challenge. Everybody knows why we're trying to do that. When we get older, I mean, if you want to stop for a minute, I'll tell you how it works. But if you want to know where I use it, it's in this rapid reduction. It's in the older people. You know, if you can just help them with their quads and glutes get out of a chair, in an older gentleman or woman, it's fantastic. If you have somebody that's, you know, in my world where you don't have the patients, they can't do a lot of exercise. If we're doing a tummy tuck or other operations or facelifts, or you're down for a while, if they want, I never say that this is all you need. I think you need a gym, you need a workout, but I love the fact that it can get you back quickly when you've been forced to get off through injury or illness, after pregnancy, postpartum. If you have any kind of thing like that, it's a super adjunct and a maintenance program. Next slide. So again, what I was going to say is most EMS devices, initially you couldn't do it because they hadn't figured out, we had this problem with thermage, but electrical devices have what's called an edge effect, and that can create a problem. You can't get a whole lot of energy. But you figured out the contraption. James figured out the way to make these electrodes work, and then the software itself allows us to get really nice energies and effective energies for the first time. And so they only, previously they had a positive and a negative electrode, so you could just go one direction. And if you do repetitive stimulation for a long period of time in one area, then, as you know, you can plateau. And then I'm going to move this. I can't see my other slide. Repetitive stimulation limits this long-term performance. So let me show you the difference with PureImpact. Go ahead. I'm actually going to make this. There we go. So the PureImpact VIP, it basically supports muscle progression. It's like you're working out. If I could tell you in a way, you've got to really kind of see it. And the beauty is the GUI, which means that's just the interface that you're looking at, shows you what muscle and show what exercise you're doing. It's for continuous whole body exercises like you would do in a gym, and you can feel it when you do it. Next slide. I think the next slide shows you that. Well, this one shows you that what's different is what's different from traditional EMS is that these electrodes can actually change their polarity. So you could take one electrode and change it to positive to negative, and the other one, see how it's going in different directions. And that way you can get a turn of the core. You can do kind of like, if, you know, when you raise up and you twist in a sit up, you can do that. When you can do a straight sit up with a rectus, or you can turn, you can get obliques. And it changes the polarity, which is an amazing thing. It's one where you can actually turn and twist rather than just going in a straight line. And so next slide. Yeah, directional muscular activation. You can link these muscle groups together, and you can do adjacent muscles like quads and glutes to mimic these gym exercises. I think and anybody can do it, from Mr. Olympia or somebody that's never really trained. And it's really low joint stress, high load, but low joint stress. You're not working against gravity there. So next slide. Yeah, this is what I wanted to show you. That it's very, very intuitive. So you're seeing what exercise on the right side you're trying to do, or down there in that diagram. So plyometrics is really just an exercise training that uses the speed and force of different movements to build this muscle power. It's kind of like, as you can see here, it's kind of like doing plyometrics. It's like doing a burpee. You can do oh my gosh, I'm blocking on where you bring your knees up. What am I thinking of? I do it every day. I did it this morning.
Squats.
I'm losing my no. It's where you're down in a push-up position and you're bringing your knees up to you. She's doing it on
mountain climbers.
Mountain climbers. See,
Yeah.
That's what you get. That's what you get when you get an old fart on this thing. You lose your mind. I'm on too many statins, but basically you can do mountain climbers, you can do burpees. It's really amazing, and you can feel it, and it's really something. And so you've got 6 different electrodes, and you can do it simultaneously. Now, next slide.
Mm-hmm. Sorry.
Yeah. So the point is I've had this. It was something. So there are a ton of different exercises. I don't know the total exactly, but basically arms, I did a biceps, triceps, I did quads, glutes, abdomen. I put it to work, and I've got, like, for example, I've got an arthritic patella, and it's because that patella goes laterally. So I can release that tightness by a roller on my IT band, but I have to build my quad up in the medial quad, and you can just put that right where you need it and build up that quad so it'll pull that patella back around. And I'm already seeing a difference. And the future is great because you showed pictures of their back and things like that. One more slide. Yeah, so you can see some improvement there if you look at the definition of the arms on the right. That's 4 PureImpact and Lift HDs. And if I've lost you for a minute, I want you to, one more slide. There's one critical part that I'm going to leave you here with, but you can see baseline in 1 month after 4 impacts. I love the honesty of that because, it's not like they told you could get that in one treatment, but I think you can see the definition. And one thing that may not be on these slides, but I want to make sure you all realize that Kia Mosavagi, who was president of ASAPS last year, did a study and proved the first functional improvement with PureImpact with a EMS device, showing that there is you can actually jump higher, run faster, that kind of thing. The one thing that this is the end of the slide, so let me finish this one thing. This is the main point I want you to know. With the science is one thing, but the thing that I want to make sure you don't miss is that if you have the PureImpact VIP and the Lift HD, you can be doing a PureImpact with 3 different muscle groups, doing burpees or mountain climbers or something like that, and you can do Lift HD at the same time. And I'm going to tell you that, having experienced it, James told me about it, and our girls have confirmed it, as well as myself, my staff, is that how you take people. Maybe if you stop the slideshow, you can see me talking, whatever. But my staff, what happens is that, you know how you put like a vibratory stimulus when you're injecting, the gate theory, when you're injecting or whatever. If you're doing the Pure Impact VIP, that's the ultimate gate theory. So when you do Lift HD or just a regular Sofwave treatment, the discomfort goes way down because they're distracted. They've got the gate theory over their whole body but you can do it at one time. It's not like, so that the efficiency of this is amazing. Russing, treating 3 muscle groups as well as doing a soft wave at the same time. So it's pretty cool technology that's given us a huge advance. And like I say, it's still growing in my practice. It's growing in CPP. That's 67 clinics. And we have the ability to choose whatever devices we want. And we've pretty much foregone. I mean, we have RF microneedling maybe for certain cases of acne and things like that. But in terms of volumetric, I agree with the speakers. This is a big step forward, and the Pure Impact VIP is a step forward as well. So we really enjoyed it. I hope that makes some sense.
Doctors, thank you for your time. Thank you again to our presenters and to everyone joining us. We'll see you next time. Have a good evening, everyone.